Will say aye. Aye. Contrary, no. The ayes have it. The question now is that Vote Health stand part of the schedule. Call Grant Robertson.
Thank you very much, Mr Chair. It's a pleasure to rise and take a call on the estimates for Vote Health. And the estimates for Vote Health didn't get off to a great start for the Minister, Mr Chair, because the Minister's press statement from the 19th of May, after the budget came out, told us that Budget 2011 is delivering an extra $2.2 billion to public health services over the next 4 years, including an additional $585 million in initiatives in 2011-12. Well, that turned out not to be true, Mr Chair, because in this House, over a period of days, admittedly, we were able to draw out from the Minister that in actual fact, the $585 million additional in this budget actually isn't. It's $420 million additional and $165 million worth of money that has been cut from elsewhere in the health sector. But sadly, this is typical of this particular minister's approach. The smoke and mirrors, the manufactured targets, and no, the reality is, Mr Chair, that $165 million of the so-called additional $585 million is in fact money taken from other parts of the health sector. So it was a bad start for the Minister when it came to these estimates. But then when the Minister arrived at the Select Committee to go through the estimates, we had to ask the Minister to give us a little bit more information on where some of these cuts were coming from. And in fact, in particular, the question of the $61 million of unspecified cuts to the public health budget. And the Minister was asked to provide some information on that. And in the transcript from the hearing, the Minister was peculiarly unable to tell us what those $61 million worth of cuts were. He couldn't actually define them. He had a bit of paper in front of him, but he really didn't know what it meant and actually basically had no idea what he was cutting. $61 million going from public health, and he had no idea what he was cutting. He thinks it's hilarious. Well, that's good, because the other thing that the Minister said in the exchange that we had with him was that he would provide us with the detail and the explanation behind each of those cuts. Well, here's a question for the Minister and the Chair. Why hasn't he provided that information? He told the Select Committee he would provide the information. He hasn't done it. The Select Committee was forced to write to the Minister last week to ask him to actually do what he said he would do at the Select Committee and tell the committee where $61 million worth of funding has been taken from in public health. It is simply not on for a Minister of the Crown to not know where $61 million worth of funding cuts are coming from, and then to compound that by refusing to tell the Select Committee, not providing the information, and now the Select Committee's written, and as of today, we still don't have a reply. That's how little this Minister cares about the accountability in this portfolio to actually say where this money is coming from. Because to take that much money out of public health has an impact. And the Minister gets up at conferences around New Zealand and tells people that he believes in prevention. He thinks that we need to take a preventative approach. We must invest in making sure that people don't get sick. Yet his budget, these estimates, take money out of public health. The Minister was at the same seminar I was at when Sir Michael Marmot came from the UK. And we sat there or some of us stayed for the whole day, and we listened and we heard from all the experts within New Zealand in this area, from Sir Michael himself, about the importance of investing in early intervention, into prevention, into making sure that people stay healthy. But that's not what this government's doing. What this government is doing is focusing on the Minister's manufactured targets within things like elective services. And this Minister is saying, well, the member on the other side of the House says immunisation. Absolutely great. That's excellent. That's carried on the good work that was started under the last Labor government, and we can all be pleased about that. But where we have district health boards focusing more and more on trying to meet the Minister's manufactured elective services target, What that means is that funding disappears from other areas. Now, the Minister might say, oh, well, these are the nanny state health promotion ideas. Well, that's not true, because not only are they the preventative measures that keep people healthy, the services that are actually being cut under this Minister's watch are frontline services. And Mr Chair, those frontline...
Dr Jackie Blue.
Thank you, Mr Chair. I'm very